let's go ahead and get started here. So it is 9 o'clock, 9:01 on October 15th, 2020. I'm going to call the Humboldt County Board of Health regular meeting to order. First of all, we'll do a roll call for the Board of Health members. Sheriff Allen.
I'm here.
Dr. Stringham.
Yes, I'm here. Good morning.
Commissioner Brisden.
Here.
Commissioner Bell. Commissioner Bell, are you on? Commissioner French.
I'm here.
Commissioner Cherry.
Here.
And I'm here as well. So we do have a quorum, and we'll move to the Pledge of Allegiance. If you'll all please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. The next item will be public comment, and this public comment period will be for anyone that wants to address this board publicly that on any item that is not on our agenda today. So is there any public comment? You'll need to star 6 to unmute yourself. Please identify yourself for the public record. Hearing no public comment.
Mr. Chair,
Yes.
Dave Mendiola, County Manager. Just so you know, Marcia Foreman is in the middle of a flu shot clinic up at the senior center, and he will not be joining us on. And also just at that, we'll use that as an opportunity to remind folks that there is a flu clinic for the seniors up at the senior center today. It's a walk up and or drive-through combination there. So just FYI.
And Dave, this is Marcia. I'm on. I'm just going to be back and forth. I'll keep it on mute and speaker, but I'll be back and forth.
Thank you.
Thank you. Okay, we're going to do things a little bit differently today. We'll move past the first item and we'll move to an update from Tiffany Love, the Chief Operating Officer at Humboldt General Hospital on COVID-19 and HGH. Tiffany has another appointment at 10 o'clock, so we've missed her the last couple. We'll let you give us a presentation, Tiffany, and then if we have questions come up until about 10 o'clock, we can go back to Tiffany at that time. So Tiffany, it's all yours. You are on mute.
All right, good morning, everybody. So we do have a couple of updates. We have purchased the Live Process Emergency Management System with the help of the county funds. And this system will allow us to add our county officials so that they can see what is going on in the COVID-19 incident. So we sent out an invitation this morning for next Friday to try and gather all the county officials so that we can discuss what our plans are for flu season and having the COVID increase in positive cases and how we plan to manage that as an organization. We are planning to open up our screening clinic on the West Campus again from 8 to 5, Monday through Friday, starting this coming Monday. We've actually hired a practitioner to be there full time for us during this season. And also, a little fun fact, we are purchasing another retrofit for the West Campus Clinic so that all of the air will be cleaned with the HEPA filter and the UVC lights, so that that air is going to be constantly purified, up to 99.9%. It kills all germs. So people can feel confident that it's safe to go there. And we also have I call them electrostatic backpack sprayers, but basically how you can use the fogger to disinfect the areas. We're also putting dedicated equipment over there for that specific reason. Our Atelica machine is still in the process of validation. And what that means is they bring samples in for people who are positive for COVID-19, and they test the machine to make sure it's accurate. It takes a team of engineers. They've been working on this for, I think, about 2 weeks. So within 30 days, we expect the machine to be up and running. We've also had a request to look into sending tests out to LabCorp and Quest because the state testing has been behind. And so the pricing to send out to LabCorp for the rapid test is $100 plus whatever collection fee. For the antibody test, $40.13. And for Quest, it is $65 for the antibody and $100 for the rapid test. And what we would like to do, we are going to see if we can arrange to have CARES Act funds pay for the cost of the test so that we're not passing the cost on to the patient. So those are all of the things that we're working on to try and increase testing in our community and access to that test.
Tiffany, this is Ken Tipton.
Yes.
I thought we had the ability to get our rapid test done right there at the hospital.
We do. And what typically those tests are reserved for our first responders. And, you know, if people come into the emergency room and need emergent care, we have to rapid test them to make sure that we know their status and to keep staff safe. So, you know, in the past, the rapid test has been reserved for first responders and emergency care, just to make sure that because the quantities can be limited. I'll tell you that October 22nd, we should be able to purchase rapid tests, and we're trying to double what we can purchase. And so if they become more readily available, then we would extend that option out. And we typically let the physician leadership at the organization decide and determine, you know, when we can open up that testing or when we need to restrict it. Please keep in mind that our skilled nursing facility staff have to be tested every single week. That's any staff member that goes into the skilled nursing facility. If we were to go from a yellow to a red zone, we would be mandated by CMS to test our staff twice a week. So we go through hundreds of tests every week, just testing the staff to meet the CMS requirements. So that is why we're so careful about how we use the rapid tests.
Okay, but that is, what is the difference between the rapid test that you need to conserve for your employees and for people going into surgery, ER and stuff like that, and the ones that you would be sending out?
Well, really, it would just be that Quest would be processing that we would be sending it out to be processed by them. And they had verbally told us a 48-hour turnaround time on the swabs. So we're going to try and get a commitment in writing from them on that, and try and expand our ability, you know, where we can send tests, because the state lab has really just doesn't have a great turnaround time for us right now.
Okay, thank you. Do anybody else have questions of Tiffany?
Hi, Mr. Chair, Sheriff Mike Allen for the record. So we've been in this pandemic for about the last 7 months, I believe. And as we do this, we learn how other places are doing it as well. But during the last 10 days or so, we've actually had to send 2 of our employees up there to be tested. And we did put first responder on both of them. And one person, it took basically 10 days to get back because they did go through the state. And the other person, we had to jump through some hoops to get them to test at the emergency room. And I don't know if there's some different protocols that we need to follow in order to identify that there is a first responder clause
Prioritization.
With this. Yeah, priority on this. But I also was talking to somebody else that said that they went into their doctor's office And within 15, 20 minutes, they were able to get a rapid test and the antibody test back, within 15 to 20 minutes. So I'm just wondering, are we moving in that direction as well? Or who do we talk to about trying to get that done?
So I'm not sure what happened with that situation with the first responders. I will follow up with Janet on that. But we are trying to expand the availability of testing by utilizing Quest and LabCorp in addition to the resources we have at Humboldt. And we're going to try to use CARES Act funding so that we are not putting a big financial burden on the patients. So let me look into that because really from the beginning, it's always been stated that our first responders will get priority. So I'm not sure what went wrong, but I will follow up on that. And I would say in the future, if that's an issue, reach out to me. I'm over the lab. Typically, that goes through our infection control person. But again, if something went wrong, if you feel like you're having challenges, please reach out to me. And then that way I can look and find out what is the concern.
All right, thank you. Both did come back negative, so that was fortunate. But it did take, up to about 10 days to find out about that one. But
Right.
thank you.
Which is why we're trying to move away from the state lab and offer other options.
Yeah.
Thank you.
All right.
Other questions? Does somebody have a question? No? Okay, thank you, Tiffany. One other question I have is, you said on the 22nd of October, you were going to be ordering a large order. You don't have those on order as of today.
Yeah, the order actually was placed months ago. Believe it or not, there had been a restriction on us being able to order from commercial labs. So that has been lifted. And so months ago, we actually placed the order and it's due to ship on October 22nd. So of course they can come back and say, oh, it's on hold, but we're hoping that it will ship as planned.
Okay. And
Tiffany,
approximately.
This is Marcia. I'm wondering, are we counting those tests that you're doing for the employees for long-term care? I know that's how Lovelock is getting some of their numbers so they can stay out of the red.
So no, so we cannot count rapid tests unless they're entered into the state's ELR. So we have been working for months to get an interface with the state. I think we're very close to having it complete, but the state will not allow us to count any rapid tests unless they are in that computer system. So we're working on it. We're not there yet.
Isn't it also true that the state put out a mandate that the rapid tests are not to be used in long-term care for either employees or residents?
I am not familiar with that.
I can send you that email if you'd like.
But Janet handles that. I'm not familiar with that,
Okay.
but Janet is the one that would need to know that. So she probably does. I just don't know that answer.
All right. Any other questions? I had, but I forgot what it was now. Thank you, Tiffany. We'll move now to the update from the Public Health Officer, Local Emergency Manager, and Public Information Officer on the COVID-19 response. And we'll start off with Dr. Stringham.
Good morning, everybody. Can you all hear me?
Yes, we can. Good morning, Doctor.
Good morning to you. So I've got some things that, Tiffany, that I can share also about some of the things that you were talking about and maybe help to clear up some of the questions from my perspective. And first, I'd like to start by saying that I really appreciate the assistance we're getting from Humboldt General and some of the other community leaders in helping to address some of the issues that Tiffany talked about this morning. And we've been working really hard on this. I think we've got some good answers that'll be in place, hopefully today. And so essentially, I just want to be able to start my comments by explaining that, of course, as I think most of you know, we do have a pretty significant uptick in cases, and really worried about that. To put things into very simple perspective, about 4 weeks ago when we visited, we were seeing about half a case per day trickle in. It was about one case every 2 days was about what we were seeing in our community. And about 3 weeks ago, that went to one case per day. And now we're pretty solidly at or slightly above 2 cases per day. And so I know a lot of cases, the numbers get a little bit confusing, but these numbers are really showing that there's a pretty dramatic uptick. The other thing to remember is that the scale of infectivity is a logarithmic scale. So even though numerically there's a small difference between 1 and 2, from a logarithmic standpoint, it really dramatically increases the potential for what I personally like to follow. I know the state has 3 different metrics that it follows to assign us various risks, but I'm pretty simple-minded, and my gold standard is how likely is it when I walk around in the community that I'm going to get this virus with contact with any one particular individual. And when we go from 1 case per day to 2 cases per day, boy, that probability dramatically increases. And that really is, in my opinion, the number that we should keep our eye on. That's really where the ball is. We now have 151 cases in Humboldt County, and this number is growing very quickly. So McDermott also has seen some pretty dramatic increases over the last couple of days also. They had been completely acquiescent for a number of weeks, and at this point they have quite a number of new cases that they're seeing there also. So I think that in terms of reasons, I think there are a number of different reasons for this. And the first is that we're seeing increased travel. Folks are going out of the community to areas that have higher case concentrations and bringing the virus back. The other issue is that we're seeing what I call imposter illnesses, and that is things that cause a person to believe that everything's okay, but they're actually not. And one of the things we're seeing quite a lot as the rabbit brush is coming into bloom, people who have pre-existing allergies are identifying symptoms as being allergic. And I'm noticing when I ask them, do these symptoms seem exactly the same as your allergies have in the past? And usually you see a pause and the person thinks, and that's our first clue that this does not resemble allergies. So it's very important for everybody to be super cautious and not be too quick to misidentify this as it really is. The other thing is influenza. Few cases so far. That hopefully won't ramp up too much this year, but a lot of people are misidentifying this illness also as influenza and the common cold, which it absolutely is not. So if people develop symptoms, definitely identify these as being COVID first and default to that explanation before going to more benign explanations. So what I call self-misdiagnosis, and that's a really big factor. We're seeing that a lot in the community at this point. Still, it's accurate to say that most of the cases we're seeing are being transmitted in private environments, in parties, gatherings, get-togethers, and we're still seeing virtually no cases that are transmitted. I know of no case off the top of my head, but I'll say for the sake of safety, virtually no cases that are transmitted in the so-called managed environments in areas such as businesses, public institutions, things of that nature. So businesses, I think, are doing a great job. Government, I think, locally is doing a great job. And but really, where the problem areas are private settings and environments. I'd like to. I know I tend to talk a lot, and so I want to mention something real quickly before anybody loses more attention than sometimes you might, and that is. That I love to fly airplanes, and one of the hardest parts about learning to fly an airplane is going from flying as a theoretical concept to actually making your body do the things it needs to do in order to get that airplane to fly. And in this case, I would say it's the same with the virus. Most of us are learning the concepts pretty quickly, pretty readily, and I think most of us are grappling and really mastering the concept that the virus is transmitted, 6 feet is minimum, masks are critical, hand washing. I think we know those as concepts. We also know that people can infect us even when we know those people, when we're related to those people. But what's going on is we're failing to apply those concepts and looking into the real world and seeing where those theoretical concepts actually apply. The very same person who can tell you, yes, I know that when my cousin comes over to visit from Salt Lake City, that I can get infected. It's very dangerous. but then they may actually tell you that as a theoretical concept as they're sitting there and talking to their cousin from Salt Lake City. They're not applying the fact that that is the same situation. So it's critical that we make that connection between theoretical and actual. It's probably our biggest single threat at this point, that failure to make that theoretical connection. The next thing I'd like to talk about is the three opportunities that we have at this point. And I think we've got a very concerted way to deal with this uptick. And I'm very pleased with what we've done so far. And I want to kind of roll that out and explain a little bit about what things are looking like. So the state of Nevada, with I think the best of intentions, has set up the three metrics that we're all familiar with for community standards and for risk stratification. And one of those, as you know, is that we are looking at the number of tests done in a community. And so naturally, all 17 counties have a motive to increase the number of tests that we're doing. But what this is doing is it is completely backlogging the state laboratory. And so it's kind of an unintended and unfortunate complication of this metric system. But the problem is that the state laboratory has typically been about 2 to 3 days out. 4 and 5 has been getting a little bit long. Now we're about 10 to 12 days out. So when you send a laboratory sample to the state laboratory, that result may not be back for 12 days. And I want to translate that into a language that's a little bit easier to understand and really puts this into perspective. The testing that we're doing is useless. To have 12 days required to get a laboratory test back, what that means is that testing is no longer a useful thing to do. And quarantines are running out almost faster than our ability to get test results back. And so about halfway through last week, when we started to see this as being a problem, I contacted folks at Humboldt General Hospital and made a number of other calls to other people to try to set up a system that would work well. And Tiffany was one of the people who we called attention, and she's very helpful in helping us with this. And Janet and Leanne at Humboldt General Hospital, so Tim, the administrator. And so I think everybody's really come together on this. And what we determined is exactly what Tiffany had said, that for $100, we can send laboratories to an outside reference lab. And while those are not technically rapid labs, they come back so quickly that we can essentially consider them to be a rapid equivalent. So it's a nasal PCR test, and Humboldt General is able to collect those efficiently and safely. And they've got a great collection center where people can go and go there safely. If they don't have the virus, it's almost impossible to get the virus at Humboldt General because of the various techniques that are being used there. So it's very safe. But Humboldt General then sends those laboratories out that very same day, and LabCorp usually, and Quest is able to do this too, as Tiffany had mentioned, is able to get results back within 24 hours. And essentially what that does is it puts us back in the game. And I want to give you kind of an example of why this is so critical. As many of you know, I'll talk in a couple of minutes about the school issues that we've been having going on. But Dr. Anthony Fauci has explained that you're not going to test your way out of this. And while that's true, it's also true that in cases where we have a person who's been in contact with somebody who's known to be infected, and now that person goes into the school system, that person has a very low probability of actually having the virus. But if they do, they've already been in contact with quite a number of different people. So we say these are low probability cases, but with lots of subsequent contacts. And so if we can rule that person out early in the game, then the amount of quarantining that we need to do goes down dramatically. And so that is a case where getting a 24-hour trustable test result back is just an absolutely fantastic thing to be able to do. So the other thing is that Humboldt General has been doing, I think, a great job with acquiring, to the best of their ability, the rapid tests. But the problem is they're in very short supply nationally and internationally too. And because the state of Nevada had been our ultimate source of the Abbott rapid test device, the state of Nevada is currently our only way to get those test cartridges. So, and soon that won't be the case any longer. We'll be able to buy them, as Tiffany had indicated, directly through the vendor. And but we don't know what the supply chain is going to look like at that point. Right now, Humboldt General has approximately 146 tests, and that's a remarkably small number compared to the needs that the hospital has. And so we try very hard not to use those tests to burn through them for non-emergent cases. But this new proposal that we have, by getting monies, hopefully through CARES Act doctrine, and also being able to get ready access to a test that's very, very quick, and the logistics that we've been able to work out with Humboldt General, I think should put us right back in the game. So we won't have to burn through our precious supply of rapid tests, and yet we'll still be able to get great results, and I think everybody will be really happy about that. So I think it's a great option. It's a wonderful way to kind of be able to help us out a little bit. And in terms of other things, be happy to answer questions in a couple of minutes about the testing issues. And but I think we have a good plan at this point. I think we'll be in a position where the tests are again useful. And my supposition is the state up. That's what we're hearing in order to meet some of the demands. I think this is just kind of a cash flow, so to speak. It's a test flow sort of a problem. And so in terms of other needs that we have, other areas where our community can really step up and be able to meet the demands of this uptick. First is the FAST team. And FAST team members currently, Jonathan Bidlake Pritchard and Allie Cruz, they are absolutely top-notch, fantastic human beings. They're both really burning the candles at both ends, because this is not the only thing they're doing, but there are two principal team members at this point. We have a couple of other people who are also filling in as needed, but we really need more members on the FAST team. And so if you know of anybody who's interested, who might have a knowledge base that would be useful, we found that folks in law enforcement and various emergency services and other fields tend to already have a great flavor for this. But if you know of anybody who would be able to help us out, please come forward and contact me at my personal email address, and that is cs@charlesstringham.com. And I'll tell you the address again in a couple of minutes to give you a chance to get something to write with if you don't already have one. So that's a great way for us to be able to meet the demands of the virus. So we've had a couple of school cases, 3 cases of interest in all, with 2 actual children who've been infected at the schools. I'd like to tell you that I'm very impressed by the way things have been handled. I think that the protocols that are already in place at the school district have kind of been given the smoke test by this, and things are good. So we've had no cases so far that have been transmitted at the schools. So I think that a lot of the programs that have been put in place by Dr. Jensen and others, I think are really working well. The social distancing, the mask wearing, the hand washing, I think are all playing a great big role in this. So there was a child at Grass Valley Elementary who was tested positive, and this was approximately 12 days ago. So remember, 14 days to watch all of your contacts. So we still have a couple of days left to go, but so far, very thankfully, there have been no case transmissions that have been known to have occurred at the school as a result of that child who had the infection in school. And we've had another case at Lowry where a student was infected, became infected outside of school and arrived at school infected. Very short period of time that we think the infection existed at the school. And again, we have a number of students who've been quarantined, and but we have not seen any symptoms transmitted yet. We're still monitoring that situation. It's in progress. And then we had a case at the junior high school where a student was not infected, but a parent was. And there's a lot of contact between the student and the parent. And this is another case where the ability to rapid test by using tests that are not rapid tests theoretically, but come back very quickly, can really make a big difference in our ability to deal successfully with those cases. So in closing, I'd like to invite everybody to incorporate something that I think is very important into the way that we deal with this, and that is causing what we all know on a theoretical level to translate to pattern matching and the things that we see happening around us, to actually identify real life situations as being the very things that we're talking about, and learning to identify and actually act on those threats, those risks, to minimize this. And I think in order for us to win this battle at the county level, it's going to take commitment on the individual level from every single person in the community. We're hearing some good things on the vaccination front, And but I think that really the way that this is going to be won in the short game is going to be with every individual doing the right things that we've talked about. Thank you very much, everybody.
Thank you, Dr. Stringham. Any questions for Dr. Stringham?
Good morning, Mr. Chair. That's Sheriff Allen. I do have a question for Dr. String, a couple of them, or Tiffany. On the best case and worst case scenario on a rapid test, how long should we be expecting it to take?
Well, the term rapid test is kind of a funny one. And so there are true rapid tests. We have the Abbott rapid test here in Humboldt County. I think, as Tiffany had indicated, after the 22nd, we should have approximately 1,200 tests. And so that will give us the ability to start doing true rapid tests on site once that supply is freed up a little bit. And then we also have kind of what you might call de facto rapid tests, which are the tests like the standard conventional PCR tests that are merely done through LabCorp or Quest very quickly, and that's a faster turnaround too. So to answer the question directly, the true rapid tests usually come back in about an hour. It actually takes longer to get them entered into the computer and get people all processed than it does to run the test itself. Super fast, so about 15 minutes or an hour. And then the kind of de facto rapid tests back in about 24 hours.
Okay, thank you. And then I have one more question. I did see an advertisement for a basically over-the-counter COVID test, and I think the manufacturer was Vault. Do you guys know anything about the accuracy? Do you recommend these? Could this alleviate some of the issues that we're going to probably see in the next few weeks if people want to go out and purchase those on their own?
I like that question very much, and the answer is there's a lot of complexity there. So there are currently about 6 or 8 different ways that it can be tested in Humboldt County, different techniques and technologies that are used. And so there is a proprietary set that you're talking about. In fact, the school district is going to have that fairly soon through a program called TIES. And so, for example, if a teacher is interested in being tested, they have kits there at the school that they'll have access to. They'll take their own samples, send those samples in through UPS. 48 hours later, they get a test result. The problem with that, and there are a number of different, Vault is one of the companies, and there are a few others that are doing same or similar things. The issue with that, exactly as you'd asked, is accuracy. And so first, accuracy, Ridley's is doing a self-test. That's a nasal PCR test. You essentially have to take a nasal applicator, a swab, and push that all the way back into the nasal recesses. And the problem is people don't tend to like to do that. And so they do the best they can. And the test results are not quite as accurate, in my opinion, according to what I've read. The test apparently will default to giving you a result that's entitled non-conclusive if it doesn't pick up what it's looking for. But the problem is if it does pick up what it's looking for, but just doesn't have viral particles, then you may not get a conclusive test result. So the accuracy of those is not super good. And then the proprietary devices test in a different way. So that's not a PCR test. And so it requires a nasal swab, but not actually a super far back applicator. And so those also are reasonably accurate. My personal opinion is I think we're always better off to be testing at the hospital, and that's really what I recommend. Number one, if a person is having symptoms or might have symptoms or will deny that they have symptoms, but they're pretty sure that they do, which is why they're testing to begin with, we don't have the ability to get those people into quarantine if they do self-tests. So it's almost the equivalent of a self-assessment, but then assessing a person's positivity or negativity is only part of the equation. The other part of the equation is knowing who those people are, being able to assess a risk, and getting them into quarantine. So it's a way to kind of short circuit the safety part of the system in lieu of just giving somebody an answer that they may not be able to do the correct things with to begin with.
Okay.
Mr. Chairman, this is Commissioner Cherry.
Go ahead, Commissioner.
Dr. Stringham, in regards to McDermott, are we seeing them reporting cases in a timely fashion these days? And a second follow-up question on that is, are they embracing the FAST team? Is the FAST team also working in McDermott, or do they have their own team, or how's that working?
Excellent, thanks. So the a two-part question. The first is that they are reporting cases in a timely fashion. I talk to Dr. Bay on a pretty regular basis, and I know that the cases that they're reporting are making it into the state reporting system. So my understanding is that that's happening quickly. It's happening quickly enough that that later last week we were identified as being an at-risk county based on numbers that had been generated in McDermott and incorporated into our data. And so I know that the data was reported fast enough to have identified Humboldt County as being at risk, but then when they recalculated using just the Humboldt County proper numbers, we came back down into a lower risk stratification. So I know that those are happening very quickly. And then the FAST team had been involved with McDermott, a number of and Ken Whitaker was out there and assisting. And then what happened is the state went in, or the reservation went entirely with the state. And now the state has a dedicated assessor who's out there, who's kind of tracing contacts and figuring out what's going on. And so my understanding is at this point that they're completely autonomous with state assistance. Also, CDC was there helping to contact trace, to teach, and also to contain the virus. But they've since departed as of about 2 weeks ago.
Okay, thank you.
Thank you.
Do you have any other questions, Dr. Stringham? Hearing no other questions, we thank you, Dr. Stringham.
Thank you.
We'll move on now to Captain Wilkin, your report on as a local emergency man.
Okay, good morning. It's Sheriff Allen. Captain Wilkin is unavailable, but we have been maintaining communication with the State Division of Emergency Management. There's nothing new to report there, but if anybody has any questions that I can answer, I will. And if I cannot, I will get back with you with the answer.
Do you have any questions of Sheriff Allen? Hearing no questions, Sheriff, we'll move on now to Nicole Maher, Public Information Officer, and with her report. Nicole?
Good morning. Can you hear me okay?
Yes, we can. Good morning, Nicole.
Good morning. It's great to hear all of these good things happening. I appreciate our community. So over the past 2 weeks, our local key messaging themes have educated county residents about the designations that we use in our reports. We've talked about what under investigation means, what had close contact means, or what is a close contact means with regard to the FAST team tracers. We've reminded residents that with expanded gathering rules comes a greater responsibility to protect against COVID-19. We've warned against travel. As Dr. Stringham said, many of our recent cases have stemmed from travel, and we've urged residents to take extra precautions. We've urged residents many, many times to get flu vaccinated by October 30th, Nevada Day. That's what the state's proposed deadline is, especially since it takes about 2 weeks following vaccination to develop the antibodies that fight the flu virus. We have sympathized with coronavirus fatigue. The burnout is real, and we have urged residents to develop habits with regard to mask wearing, distancing socially, and hand washing until they become second nature and don't feel so burdensome. We have stressed the importance of being forthcoming with contact tracers, and that any lack of transparency could lead to the virus spreading unchecked. We have stressed that facial coverings continue to be one of the most effective ways to slow transmission of the virus. We have encouraged local residents to get their COVID-19 information from non-politicized sources, especially during this election season. We have shared that with flu viruses and the virus that causes COVID-19 both spreading this fall and winter, it's more important than ever to try to protect people at increased risk for severe illness. And we have noted that with a rise in cases in both Humboldt County and Fort McDermott, our 3 basic precautions continue to be our #1 defense strategy. So as we look to McDermott, McDermott is reporting 101 cumulative cases. That's up 10 from 2 weeks ago. And today, McDermott has conducted 946 tests. 91 people have recovered, 1 person has died, and the reservation has 9 active cases. Marcia continues to offer testing to asymptomatic persons with no known exposure at her office. And Golden Valley, which, as you know, is a private health clinic operated by Nevada Gold, is testing both symptomatic and asymptomatic mine workers and their families with a doctor's order. 8 of our recent cases were diagnosed through that clinic. Ridley's, 8 of our recent cases were tested there. And just a reminder, as Marcia pointed out and Dave Mendiola, we are promoting and pushing for the free drive-through senior flu shot clinic today. The drive-through part takes place from 8 a.m. to 10 a.m. at the Pleasant Senior Center drive-through garage, and then the walk-up portion will immediately follow from 10 to noon, also at the Pleasant Senior Center on their back porch. And wear a mask, bring a pen, and of course, flu shots are provided by the Nevada Division of Public and Behavioral Health. These are the quadrivalent, no preservative shots, so very important, especially for our over 65 population. And Nevada National Guard, just looking to the east, continues community testing in Elko every Friday in October. Any Humboldt County resident is welcome to go there, but we would rather you stayed here and not bring back the virus with you from Elko, as they are really struggling. On our local social media channels, as our case numbers have increased, it has been gratifying, truly, to see residents on social media be very encouraging to others to keep wearing masks and distancing socially. Many residents have been very supportive of the school district's efforts to mitigate the spread of the virus. As Dr. Stringham said, we've had 3 students who have been tagged through that process and 1 staff member at the district office. Residents also have wondered how many of the county's confirmed cases are really the flu or just a cold. And also gratifying to see that other residents shared that because of their similarities, it can be difficult to differentiate between the 2 based on symptoms alone. And so laboratory tests are required to confirm if someone has COVID-19. Residents have discussed via social media that it is possible to get COVID and the flu at the same time, which is correct. And some residents have said that stay-at-home protocols have weakened children's immune systems, so now they're contracting COVID. Others have countered that there are no COVID medications or immunity-boosting supplements that can cure or prevent coronavirus, which is true. But we also advocate good eating, exercise, plenty of rest, and of course all of our precautions as helping our immune system stay well. And Fort McDermott, EMS has cautioned residents on their social media channels not to travel to Winnemucca due to Humboldt County's rising numbers. On the state's social media channels, some residents have expressed thanks for a new pandemic emergency technical support grant. That's $20 million that's aimed at helping Nevada small businesses recover. Other residents have called it a hoax or said that it was too little too late. Statewide, Nevada residents reacted to reports from other states that some people received positive COVID results even though they never tested. Some said the states are artificially pumping up numbers, while others argued otherwise. Representatives from those states' testing sites say false positives aren't even possible because personal information is not submitted until right before the testing takes place. Lots of different opinions out there. Let's look at our situation report. Statewide, we're just at about 1.1 million tests performed. That's up just shy of 100,000 from 2 weeks ago. The state has only seen, I shouldn't use those words, has seen 88 deaths. That's still 88 truly affected families, but significantly down from what we've been seeing. We're at 1,691 deaths. Humboldt County, we're at 152 today. That's up 23 cases from 2 weeks ago. We continue to have the fourth highest death rate per capita in the state. Washoe, up 4,400 cases from 2 weeks ago. They're at 177 deaths. That's up 18 from 2 weeks ago. Clark, up just shy of 13,000 cases from 2 weeks ago. Their deaths up 64 from 2 weeks ago. Lander has seen a bit of a spike, 89 total cases, up 13 from 2 weeks ago. 1 death, no change. Pershing just up 1 from 2 weeks ago to 23, 0 deaths, thankfully. Elko up 133 from 2 weeks ago, and they now have 11 deaths, 8 of those coming through their long-term care facility, which is so sad. In other news of interest, as I'm sure you've heard, Caleb Cage, who is Nevada's COVID response director, has tested positive for coronavirus. He is not clear how he got the virus, although he is completing a degree at UNR and perhaps may have been exposed there, and he is doing well and isolating at home. New UNR president, Brian Sandoval, our former governor, has announced that students will not return to campus following the fall break that traditionally takes place over Thanksgiving. According to a statement from Sandoval, he said beginning on Monday, November 30th, all university courses will be delivered remotely. He said holiday travel could spread the virus with students traveling back and forth between campus and their families' homes. You've probably read about this, but the Washoe County man who is believed to be the first American confirmed to have caught COVID-19 twice is making national headlines after researchers from the UNR School of Medicine released their findings. The man has recovered, but his case raises questions, of course, about how long people are protected after being infected and potentially how protective a vaccine might be. In related news, this week, an 89-year-old Dutch woman is believed to have infection of COVID-19. Researchers note that her case is similar to that of the Nevada man. Both the man and woman had a worse sickness the second time. And the Federal Department of Health and Human Services officials, I think we touched on this just a little bit earlier, are asking Nevada to reverse its decision to suspend the use of 2 rapid coronavirus tests in nursing homes, saying there is no scientific reason to justify the Silver State's actions. So Nevada's health officials had ordered nursing facilities in the state to immediately suspend the use of 2 tests after they said the tests repeatedly delivered false positives. So just to give you an idea, 23 of 39 positive antigen test results from both tests were later found to be negative. That's an error rate of about 60%. So the Assistant Secretary at HHS said last week on Friday that false positives are a reality and called the Nevada action unjustified. Nevada, they did well. They shot back with their own letter, which was very diplomatic, saying certainly more research into the matter is needed in order to protect vulnerable nursing home populations. So health officials from both Southern Nevada and Washoe County health districts met with Governor Sisolak this past week after expressing concern that they have not been included in the state's COVID-19 response policy discussions or development of guidance related to Governor Sisolak's emergency directives. In one case, just to give you an idea, Washoe County received a plan, a gathering plan, even before they knew that the governor was going to enlarge gathering limits. And anyway, those talks seem to go well according to both parties, and hopefully will lead to better communication. Across the U.S., a third of U.S. states are reporting higher coronavirus case counts than they've ever had before. An analysis of Johns Hopkins data shows that 16 states set records for new cases in a week, but nearly all states are surging. 41 states, including Nevada, had worse weeks than they did a week earlier. And 36 states, a higher rate of people were testing positive in the week before. So I'm sure, as you've seen on the news, North Dakota, South Dakota, Montana, Wisconsin, Kansas, where one of my dear nephews has COVID right now. Poor kids in law school, so he's trying to struggle through. But North Dakota, just as a case in point, doubled its case count since September 6th. More people died there from coronavirus in the last month than in the whole rest of the pandemic. I think the sheriff said we're at 7 months now, so a record number of deaths also in Kansas and South Dakota. This is interesting and important from WHO officials have said that achieving herd immunity by allowing the virus to spread is scientifically and ethically problematic. As we know, many people have erroneously come to believe that herd immunity comes by allowing the virus to spread unchecked, thereby creating a type of immunity in the population. But WHO's chief said herd immunity is achieved by protecting people from the virus, not by exposing them to it. He added that true herd immunity relies on vaccination, and we have certainly heard that from Dr. Stringham. Last week saw the highest number of new COVID-19 cases reported across Europe, as 700,000 people tested positive. WHO said the total accounts for a 34% jump in cases in European nations. Deaths in Europe also spiked by 16%. Slightly more than half of Americans in a recent poll say they already have or plan to stockpile food and other essentials over fears of another COVID-19 surge and or political unrest after the November 3rd election. A lot of strong feelings out there on that. Based on their weight, more than 70% of Americans are at an increased risk of experiencing severe illness if they contract the coronavirus, according to new guidance posted by the CDC. You've probably heard about this, but Johnson & Johnson's COVID-19 vaccine trial has been paused due to an unexplained illness in a volunteer. And so that means that 2 of the 4 vaccine trials in the U.S. are now on hold. The other trial, run by AstraZeneca, was halted September 8th after a second participant was diagnosed with a neurological condition. Also important to note that this is not an odd occurrence. That does seem to happen with virus trials, just trying to keep people safe. As of Wednesday, which is our most recent data available, statewide hospital occupancy rates are at 74%. That's up 3% from 2 weeks ago. ICU units, 59%. That's up 1% from 58 2 weeks ago. Ventilators in use, 30%. That's down from 31% 2 weeks ago. For the week of October 5th through the 9th, Division of Industrial Relations announced 2 noncompliance violations. Fokitsky in Reno for lack of facial coverings by employees, $2,600. Dragonside Country Club in Henderson for exceeding gathering limits and face covering violations, $10,900. During the week, officials visited 218 businesses and found a 93% compliance rate. Elko County is reporting 8 COVID-19 cases within the Sheriff's Office detention facility, including 2 staff members and 6 inmates. And the new Nevada poll found while Nevada's struggled to contain the spread of COVID-19 and manage its economic impacts appears to have eroded public support for Governor Steve Sisolak. He still remains the person that Nevadans trust most to manage the pandemic. So the poll found that 48% of respondents now disapprove of the governor's handling of the pandemic, while 46% approve. In May, the same question found 64% approving of Sisolak's actions, while just 28% disapproved. Even so, respondents put the greatest faith in the governor to make the best decisions about the coronavirus, way ahead of President Trump, the federal government, local officials, or even individuals and businesses. So Commissioner Tipton asked 2 weeks ago about the types of health conditions and contributing causes mentioned in conjunction with deaths involving COVID-19. And the CDC has been tracking those figures since February 1st. And I just wanted to share a couple of figures with you today that are current as of October 10th. Keep in mind that because of the lag between deaths and death certificates, these figures account for just over 201,000 deaths. For 6% of the deaths, COVID-19 was the only cause mentioned. But for deaths with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or causes per death. So the idea is that without those, or without COVID-19, those people would not have died. As you can probably surmise, as people get older, they're more likely to have a contributing cause mentioned in conjunction with their COVID death. So this was interesting. The most common related complication for all ages, and this starts from, this is across the board from children all the way up to the oldest people who have passed away. So the most common related complication is influenza and pneumonia. Of 201,000 deaths, 86, just shy of 87,000 of those named this as a complicating cause, which is one reason we've been hitting flu vaccinations so hard in our reporting. Next highest complication, 70,000 of the cases, respiratory failure. And then quite far down the list, hypertensive diseases, 43,000, diabetes, 33,000. In all, the CD tracks 18 main contributing conditions and hundreds of less common ones. And Ken, I'll email you a link to, there's just tons of data on that, and we can break it down by state as well. So I just wanted to bring you up to date on our mitigation and management. So last week, Nevada's COVID-19 task force loosened the standards for testing levels and test positivity rates that counties must meet to stay off the state's watch list. Counties can now conduct a standard 100 tests per day. That's down from 150. Test positivity threshold also has gone from 7% to 8%. And both adjustments are in line with national standards. So Nevada's standards have been stricter. Counties with a case rate greater than 200 cases per 100,000 residents will continue to meet this criteria. As you likely know, Humboldt and Washoe were flagged a week ago Monday. This week, Humboldt dropped off the list, but there's a pretty good potential that we'll be flagged again this coming Monday, even with the adjusted standards. So I wanted to give you just a quick look at Humboldt County's case numbers per month. I was working on our plan, our mitigation and management plan, just trying to update some things in preparation if we do get flagged. And I just thought this was interesting. We've been going for a while, and I had never looked at how many cases per month we've had, but I'll just share this real quick with you. So you might remember that we had our first case on March 26th. So I combined those last couple of days of March with April, and we had 45 cases. So as we came right out of the gate running, that equates to about 1.25 cases a day. And then in May, we had 34 cases, still running, just a little ahead of 1 case a day, 1.09 cases a day. Then in June, our lowest month ever, we only had 6 cases, 0.2 cases a day. July, 13 cases, 0.4 cases a day. In August, we started creeping back up to 15 cases, which was As you can tell from that percentage, 0.5 cases a day, September 19 cases, 0.6 cases a day, and so far in October through October 14th, yesterday, 23 cases, which for now equates to 1.64 cases per day. So definitely running high right now. No single factor, as Dr. Stringham said, completely explains the recent increases in cases. However, as he mentioned, there are some points that do merit some further discussion, such as travel, either local residents traveling out of area or residents, family members traveling to Humboldt County from out of area and bringing the virus with them. And then, of course, we've got those just normal kinds of things that come with cooler weather, more activities moving indoors, schools, gatherings more, and certainly that's precipitating an increase in cases. And so with flu season in progress and our rising case numbers of COVID, we want to remind our county residents to remain vigilant, particularly by continuing to wear face coverings, practice social distancing, and washing hands frequently. That's all I have. I'm happy to answer any questions.
Thank you, Nicole. I would like you to email me that link if you would.
I sure will.
Thank you. Any questions for Nicole this morning? Any questions? Okay, no questions, then we'll move to the next item on the agenda. Thank you, Nicole.
You bet.
Approval of high-risk mitigation, consideration, discussion, and possible action to prepare and approve a plan to mitigate the county's status as a high-risk county for COVID-19.
Yeah, Commissioner, Chairman Tipton, Dave Mendiola, County Manager. I added this to it primarily because we were, with the elevated number of cases over the past 3 weeks or so, it appeared as though we were going to show up again, as we had about 3 or 4 weeks ago, as a high-risk county. Unfortunately, we did not this week. I was really expecting that we did the week prior to. I was expecting we would again on Monday, but we did not, which may just be because there was a delay in reporting of those cases, which would have required us to resubmit or submit a new high-risk mitigation plan, which we did in the past, as to how we were going to reduce those exposures and what our plan was to do that. And of course, we didn't. So we're not required to do that this week. However, I do want to make it clear that mitigation plan is available on the website, the Humboldt County website, hcnv.us. It's also available if you want a copy of it in the commissioner's office, in my office, second floor of the courthouse. So if somebody wants to get a copy of that, they can do so. We will be updating that just because there's a possibility, if we keep going at this rate, that we will probably, again, come back on that list. And so in the meantime, I just wanted the board to be aware that that we're already working on that right now, and it's pretty much most everything that you've heard today. You know, what are we doing to get the word out to Humboldt County citizens as to what they can do to slow the spread of this, and it's also about the very things that we talked about, testing, and so we're putting that together with the expectation that will happen. If it doesn't, then fine. If it does, we'll be prepared to submit that information. And of course, anybody who has any input, would like to add their thoughts or comments to ideas that maybe aren't on that current plan and or ideas that they have in general, they're always welcome to call my office or to contact Nicole Maher and give us some input, and the doctor as well. And we're happy to take any as we again all work together to try to mitigate this issue. So that was the reasoning today. Again, false alarm, but in any case, I just wanted you all to know that we do have a plan already in place. We are in the process of updating that with new information, but at this time, it's not necessary to submit to the state.
Thank you, County Manager. Any questions of any of our people today? No? Any future agenda items that any of you want to see added to our agenda for our next meeting? Which our next meeting will be on October 29th. And I may or may not be here for that meeting, but that's our next meeting, October 29th at 10 o'clock. Or 9 o'clock, excuse me, 9 o'clock. October 29th at 9 o'clock. Okay, any public comment? Public comment has the opportunity to address the commission on any matter not appearing on this agenda. However, no action may be taken on the matter until the matter itself has been specifically included on the agenda, this item upon which action may be taken. Do we have any public comment today from anyone?
Chairman
Please.
Tipton,
Yes.
Dave Yola here. I absolutely forgot about our city manager, Alicia Heiser, who has some really interesting information, and I apologize.
Perfect.
Alicia, regarding our wastewater testing that we're doing, and boy, I hope she's still on here. I'm sorry.
Alicia, are you on?
Well, it looks like she's still here. Unless it's a different Alicia, which could be possible. Well, I apologize, everybody, but we'll definitely get her on in 2 weeks, because the information every week it comes back, it's more interesting and very enlightening. So we'll do that next time around.
Okay. All right, thank you. We've already set our next meeting time. Any other public comment?
Mr. Chairman, this is Tammy. Can you hear me?
Yes, I can, Tammy.
I just wanted to comment just to make you aware that early voting does begin on Saturday here at the courthouse and will extend for the next 2 weeks. I apologize for the phones and such in the office. We are enforcing social distancing as well as the use of hand sanitizer. We will request voters to wear face coverings, but we cannot mandate it, though all poll workers will be wearing face coverings. But I didn't know if you might have any questions, and if you do, you can certainly reach out to me in the office on that. But I did want to make you aware of the practice, since I will hazard a guess and say we'll see a significant number of people moving through the courthouse over the next 2 weeks.
Thank you, Tammy. I have had questions on the Saturday opening for voting, and I'm glad you brought that up.
Mr. Chairman, this is Commissioner French. Could I ask a question?
Absolutely.
Tammy, are we going to be requiring in terms of the gathering size inside the building, are we going to be requiring people to stage outside and then come in as people leave, or are we going to just congregate up there in front of your office? Do you know?
No, the voting itself is going to occur in the county meeting room this time. It will be similar to what we did on election day in the primary, in that we will stage at social distancing distances down the staircase, through the upstairs lobby, down the staircase and/or elevator, and out the front door. So we will have limitations on the number of people that can be in the building as well as in the voting site at any one time. That's why it is indicated in the sample ballot that lines may be there. It may be time. It may not be as quick as it has been in the past to move through this process. I will have people assisting with that. We will also have manned ballots drop off at the courthouse, so that if people just want to drop off their mail-in ballots, they will be able to do that during these periods as well. Does that address your question, Commissioner?
Yes, it does. In addition to that, I've had questions as to the mail-in ballots. Those people who are coming in with a mail-in ballot in their hand, are they required to surrender that ballot before if they're going to vote in person? How is that going to be handled?
They can do it one of two ways. They can surrender the ballot, which creates the void and allows for their traditional voter card to be issued so they can vote on the ICXs. If they do not have that ballot, or if they're a same-day registrant, there is a process by which they sign an affirmation saying that they have not submitted their another vote, and then they'd be allowed to vote in person. So no, they are not required to surrender that ballot, though they may. And then same day registration this will be the first full test of this, as in the primary, it was a little different in that people who are not currently registered in Humboldt County, but have the ability, the proper ID and stuff, will be able to register and vote the same day. And of course, they will not be issued a paper ballot. Anybody that registers online through today, we will send out a paper ballot to. Tomorrow, it would require same-day voter registration and to appear in person, either during the early voting period or on election day.
Great, thank you.
Tammy, concerning the voting, I've had some questions of people that received ballots at their address from a person that had owned that property 2-3 years prior, and what should they do with that ballot?
You know, the best thing to do would be to throw it back in the mail saying not deliverable as addressed, or, you know, no longer at this location, or if they're coming in, drop it off. With that type of information, we can invalidate those voters, or not invalidate, inactivate those voters, so that we can begin to clear the records. We reach out in every way possible to dates, but some people don't put forwarding, some people don't bother to let us know they've moved, things like that. But that return mail aspect will inactivate that voter, so ballots and mailings are no longer generated.
All right,
And it begins
you.
the timeline for us to actually get them canceled from Humboldt County rolls.
Thank you. Any other public comment? Hearing no other public comment, this meeting is adjourned at 10:13 a.m. Thursday, October 15th. Thank you, everyone.
Thank you.